Consultations for Health, helping you progress in communication skills to optimise the care of your patients. This video will focus on talking with other healthcare professionals about patients and your concerns. This is critical as a healthcare professional, since being able to share patient information appropriately to someone else can ensure an effective transfer of information between services and disciplines. One tool which is helpful when exchanging patient information is SBAR. The acronym SBAR refers to situation, background, assessment, recommendations. SBAR helps you formulate your thinking before having to share your knowledge in a logical way. You will also find gaps in your information by doing this. For more information regarding patient information gathering, check out our video playlist linked below. SBAR also allows the other professional to follow along without needing to interrupt or go back over something until the end. This allows a collaborative discussion about the next steps for this patient, with both parties fully understanding the clinical rationale before going ahead. Let's watch a scenario with a doctor and a nurse where SBAR is not used effectively over the telephone. If talking over the phone is something you would like further information on, please check out the video linked in the description below. Hello?
Hiya, I've got a patient. I think they have rectal bleeding. Can you come have a look?
Sorry, who are you?
Oh, sorry, I'm one of the nurses on ward A. Yeah, I've just got a patient. Can you come have a look?
And what's wrong with them?
Well, they say they've got rectal bleeding, but to be honest, I don't really know. I've just been told to give you a call.
And have you got any observations?
When I looked a couple of hours ago, everything was fine, but I haven't got any recent ones.
Right, okay. Doesn't sound that urgent. Whereabouts are you?
Ward A.
Okay, well, I've got a couple of other urgent jobs to do, and then I'll pop up to ward A and see what's going on.
Okay, cheers.
In summary, the caller did not give enough detail in the relevant order to allow the clinician to add to the conversation and create a plan together. Instead, the recipient had to ask basic information questions, like why was the patient admitted? The clinician then assumed it wasn't urgent because the caller did not give enough details to make it seem urgent. The caller was not fully aware of the patient's status and stated unprofessionally, "Someone else told me to call you." Let's look at a different scenario. Hello?
Hi, is this Dr. Johnson?
Yeah, who's calling?
Hi, it's Nurse Amy from ward A.
Oh yeah?
Hiya, I've got a patient here, AB. She's post-surgery, but at the moment she's in extreme pain and tenderness around the site of the surgery. We've given a standard pain relief and she's on standard prophylactic antibiotics, but her pain score is now at an 8. Her temperature's increased from 36 to 39 over the last couple of hours, and we're concerned that the antibiotics aren't working. There's actually an infection there. Are you able to come take a look at her urgently for us?
Yeah, sounds like she does need to be looked at. So that was AB, ward A, tenderness, pain and raised temperature post-surgery. Yeah. Okay, I'll meet you in the ward in 10 minutes.
Brilliant, thank you so much.
Thank you. In summary, this conversation was better structured and contained more detailed information at the appropriate places. No conversation is ever perfect, and SBAR is just one of the many tools that can be used to improve interprofessional communication. It's normal to feel anxious or awkward when using a new tool like SBAR, especially if you are one of the few people using it. However, SBAR is a great tool to improve our communication between colleagues and helping hand over patients to different specialities. When implementing SBAR, encouragement from your peers and colleagues can go a long way. This can be offering extra support, encouragement and scheduling time to practice. Some hospitals have found that using SBAR notepads, pocket cards and stickers on telephones are useful aids in the early stages of using this tool. We hope you have found this video helpful, and we would appreciate any feedback in the comments below. This video is only designed to touch the surface of talking to other professionals, helping you to have a foundation to build from in your future practice. Thank you for watching Consultations for Health. Feel free to check out our Facebook, Twitter and other YouTube videos. Don't forget to like, comment and subscribe for more videos in the future.